The signs of a stroke usually show up out of the blue, but that doesn't mean that you won't have time to act. A study found that 43% of stroke patients had warning signs of mini-strokes up to a week before the big one hit. Imagine being able to recognize the early warning signs of stroke could be the key to saving a life. A stroke happens when the blood supply to the brain is interrupted. In about 80% of cases, this happens because of a blood clot or blocked artery. In addition, strokes can happen when blood vessels are damaged. When the brain doesn't get enough blood, if the supply is interrupted for long enough, the brain cells will die. In this video, we'll share the top 10 warning signs of a stroke that you might notice up to a week before it actually happens. Before we continue, just a quick reminder that this video is for informational purposes only. Do speak to your doctor for medical advice. Your blood pressure is high. High blood pressure harms arteries all over your body, making them more prone to bursting or getting blocked. When arteries in your brain are weakened or clogged, your risk of stroke increases significantly. That's why it's so important to control high blood pressure to lower your chances of having a stroke. Face drooping. If you ask them to smile, the face will be droop on one or both sides, and they may be unable to smile or speak clearly. Facial drooping is a common symptom associated with a stroke. It affects the muscles on one side of the face, causing them to weaken or become paralyzed. As a result, they may notice that one side of their face appears to droop or sag when they try to smile or make facial expressions. This drooping typically occurs suddenly and is often one of the earliest signs of a stroke. It's important to recognize facial drooping as a potential symptom of a stroke, so get help immediately. Difficulty speaking. When someone experiences a stroke, it can affect their ability to speak clearly. They might start slurring their words, making it difficult for others to understand them. Additionally, they may struggle to repeat a simple sentence or find the right words to express themselves. Difficulty understanding what others are saying. This difficulty can manifest as trouble comprehending spoken language, confusion about words or sentences, or an inability to follow conversations. It's like suddenly finding it hard to understand what people are telling you, even if they're speaking clearly. Numbness or weakness on one side of the body. This often affects just one side of the body. If you ask them to lift both arms, one will drop lower than the other. A sudden severe headache. A really bad headache that hits suddenly could be a sign of a stroke. Sometimes you might also feel like nausea and vomiting, or have changes in how aware you are, along with the headache. Trouble walking, loss of balance. If someone is having a stroke, they might stumble around, feel like they're losing balance, or have trouble coordinating their movements. Basically, they might find it hard to walk normally. Vision problem. When someone experiences a loss of vision or changes in their vision in one or both eyes during a stroke, it means that something is affecting the blood flow to the part of the brain that processes visual information. This can result in various visual symptoms such as blurred vision, double vision, or even complete loss of vision in one or both eyes. These changes may occur suddenly and can be alarming. Fatigue. Are you feeling tired all the time, even you have enough sleep? Don't just brush it off. It could be a sneaky sign that a stroke is lurking around the corner. Chest pain. Chest pain can be a sign of a stroke, but it's important to understand that it's not always the case. Chest pain might be a problem with the heart rather than the brain, which is what a stroke affects. However, in some cases, chest pain can occur during a stroke due to issues with blood flow to the heart or other related factors. If someone experiences chest pain, along with other stroke symptoms like difficulty speaking or weakness in the face, arms, or legs, so don't ignore these early warning signs. Seek help immediately, because a more severe stroke could be just hours or days away.